So with that, I'd like to welcome and introduce Colton Rector. We've had a great working relationship with Colton for the last few years. He is our Medicare expert, and he's going to run through a presentation today with you on Medicare benefits. And even if you're not quite to 65, if you're on the precipice like me, this might be information that would be beneficial for you. So Colton, thank you. The floor is yours.
Thank you. My name is Colton Rector. I'm here to talk to you guys today about Medicare. I apologize in advance. I have a teething baby at home, so I've not got a whole lot of sleep this week, so I apologize if I'm a little bit off. My agency is called Denny and Associates. My grandfather started our company in 1982. He is since retired. My mother's our current president. I've been a licensed agent since 2015. Been focusing solely on Medicare since 2017. So I might look young, but going on 8 years now living and breathing Medicare. So as an agency, we provide a completely free service to a client in going over their Medicare options. So we'll explain the ins and outs of Medicare, talk about the different types of secondary plans, Medicare Advantage, supplement, Part D plans, so on. We'll look at your doctors, your medication, your situation, figure out which plan makes the most sense for you, and assist you in getting enrolled in that plan. Lots of slides in this presentation. You have the full presentation in front of you. I'm not going to talk on each slide. I'm going to focus on just a couple of slides and just do talking just in general. Questions, please just shout it out, raise your hand, whatever. You'll get a lot more out of the presentation if you do ask questions. They're more than welcome. So to get started, what is Medicare? Original Medicare is known as Part A and Part B. This is the federal health insurance program that offers a variety of healthcare expenses to those eligible. Part A is the hospital insurance that covers things like inpatient hospital stays. Part B is your medical insurance. Part B covers all of your outpatient services, doctors, tests, labs, everything else is under Part B. Part A is free to you as long as you've worked approximately 10 years or 40 quarters, you paid that Medicare tax. You do pay a Part B monthly premium. That Part B premium is based on your income. If you have this page, I want to make a note on this. These are they're incorrect numbers. These are from 2023. So I'll give you those 2024 numbers if you like them. So in 2024, the Part B premium, they're looking at your modified adjusted gross income from 2 years ago. So for 2024, they're looking at your 2022 tax return. So that first premium is actually $174.70 per month. So $174.70 is the standard Part B premium. It goes up a little bit from there. The next number is not $230. It's actually $244. And then from there on, it just goes up just a little bit. So per month, standard Part B monthly premium is $174.70. Let's skip ahead here. Back here. So again, Part A covers inpatient hospital stays. Basically anything done that you have in an inpatient hospital setting is under Part A. Part B covers your doctor's visits, your tests, your labs, your surgeries, your scans. Anything that's not done in the hospital is covered under Part B. A very just generic overview, just elementary way of looking at parts of the coverage for just Part A and just Part B as if you had no secondary plan, which you will have a secondary plan, so don't dwell on this. But basically, Medicare A and B covers everything at 80%, so you're on the hook for the other 20% out of your pocket. There's no cap to that 20%. So a couple doctors, tests, labs, surgeries, whatever, that 20% could be a very high number. On top of that, Part A and Part B does not cover your medications, does not cover dental services or vision services. So you need a secondary plan to come in and fill in the gaps and cover what Medicare is not going to cover. And that's what I'm really here to talk about today. So you have two different options to again, fill in these gaps. Option number one is what's called a Medicare supplement plan, paired with a Part D as in dog plan. Option number two is what's called a Medicare Advantage plan, sometimes referred to as Part C. So I'm going to explain the differences between these two types of plans. This is what you're really choosing between option one and option number two. So option number one, the Medicare supplement plan. Medicare supplement plans are offered by private insurance companies, United Healthcare, Anthem, Blue Cross Blue Shield, Mutual of Omaha, so on. There are 10 different plans that you can choose from under option 1. They're labeled as plans. So there's a plan A, plan B, D, G, K, L, M, N, C, and F, half the alphabet here. I'll make this part very easy. So just for my example, typically if I have a client who goes with option number 1 instead of option number 2, so they're going this route, 99% of the time the plan that they choose is this plan G right here. So I'm gonna use this as my example. So plan G, you're going to pay an additional premium to be enrolled in this plan. That premium is based on your age, gender, and zip code. So a male or female age 65 in the St. Louis area, you're looking at approximately $180 per month, approximately. That $180 per month is on top of that $174 per month that you're paying to Medicare for Part B as a boy. So you pay $180 per month for this plan G. Plan G covers everything at 100%. Don't just kind of ignore this foreign travel coverage, skip that for now. But Plan G covers everything at 100% except for the Medicare Part B deductible, which is $240 per year. So for this Plan G, you pay $180 per month, you pay $240 per year, and then everything else medically necessary and Medicare approved is covered at 100%. So you have no out-of-pocket costs after you reach that small deductible, all right? Plan G does not have a network. You can go to any doctor, you can go to any hospital, anywhere in the United States, as long as that doctor accepts Medicare, Part A and Part B, which almost all doctors in the US take Medicare, very few don't. Questions so far on the supplement Plan G?
And the cost for that G was what?
It's based on your age, gender, and zip code. So male or female, 65 St. Louis area, you're looking at approximately $180 per month. Move on here. So on top of we're gonna skip ahead. On top of the Plan G with option 1, you're also going to enroll in a Part D as in dog plan to cover your medications. Part D plans are offered by the same insurance companies, United Healthcare, Anthem, Aetna, so on. Part D plans range in monthly premium from $0 per month up to about $100 per month, just depending what medications you're taking. So if you're taking some very high cost medications, your Part D plan premium is going to be more expensive. If you're taking some just generic maintenance medication, blood pressure, cholesterol, whatever, you're going to have a very low cost Part D plan, say $10 per month in premium. And then when you go and pick up those medications from the pharmacy, you're going to pay small co-pays for those drugs, just like you are now. So again, a generic maintenance drug might be a $2 copay. A non-generic drug might be a $6 copay, and so on. So you're paying small copays for these medications as you pick them up from the pharmacy. All right. And then option number 2, go back here. So option number 2, again, is the Medicare Advantage plan. Medicare Advantage plans are sometimes referred to as Part C. Medicare Advantage plans are offered by the same insurance companies, United Healthcare, Aetna, Anthem, so on. Medicare Advantage plans bundle and include the medical part of your plan. It includes your Part D for medication coverage. It includes your dental insurance, vision insurance, and several other bells and whistles, all bundled into one plan under one premium. The premium for 95% of all of the Advantage plans in this area is $0 per month. So you do not pay an additional premium to have this Advantage plan. You're still paying that $174 per month for Part B, but nothing on top of that in monthly premium. It's truly $0. So I'm going to show you an example of a Medicare Advantage plan. I'm not going to say who this is with. It doesn't matter. This is what most plans are going to look like in this area. So monthly premium, $0 per month. These plans are going to work very similar to any employer plan or ACA plan that you have now or that you've had in the past, where it's a pay-as-you-go system. So you're paying co-pays for all the services as you receive them. Just for some examples here. So the plan does not have a deductible. So you do not have to reach a certain dollar amount before the benefits kick in. It starts day 1. The next biggest number you look at is what's called your annual maximum out of pocket. With this plan, that number is $2,900. That's your cap. That's your safety net. all of your copays that you potentially incur in a calendar year go towards this $2,900. If you hit it, then the insurance company steps in and picks up everything else at 100%. So that's your worst case scenario. So some examples of the copays that go toward that number. A primary care doctor visit might be a $0 copay. To go see a specialist might be a $25 copay. A night in the hospital, $245. An MRI or a CAT scan, $85. Lab services, typically $0. ER visit, $90 copay. Urgent care visit, $40 copay. So you can see the copays are typically a flat dollar amount. That's going to be different than what you're used to right now. Also, right now, your plans, you have to reach your deductible, then you're going to be paying like 10 or 20% co-insurance for most of your services. That's different here. They're just flat dollar copays for almost all services. To continue on, these plans have your dental insurance included. So like your plan, if you have dental insurance right now, you might have a $1,000 or a $1,500 annual allowance for dental services. Same thing with these Medicare Advantage plans, approximately $1,000. Your vision insurance is included. They'll give you like $300 per year for a new pair of glasses. They have other bells and whistles too. They have gym programs. If you've heard of Silver Sneakers before, there's over-the-counter allowances. They'll give you like $75 a quarter to go and buy vitamins, supplements, ibuprofen, all types of things. So all included in this Medicare Advantage plan, all kinds of other bells and whistles. Part D is included. So the same Part D plan that you are purchasing with option number 1 is included for free in the Advantage plan. So no monthly premium for it. You're still paying co-pays for those medications as you pick them up from the pharmacy though, just like you are with your current plans now. We're gonna skip way. This is an example of a Part D plan. This is whether you're getting it through option number 1 or through option number 2. So this is what your Part D plan could look like. So some drug plans do have a deductible. This example does not. So a tier 1 generic drug is a $0 copay, tier 2, $12, tier 3, $47, tier 4, $100, and so on. So what I do as an agency is we would look at your medications. We would go to a website called Medicare.gov, which you all have access to. I would put in your zip code, all the medications that you're taking, and it'll show me every single one of these plans that's available to you and exactly how each one covers your medications. So it literally tells us which plan covers your drugs the best to the worst. So it's an incredible tool that we all have access to. So again, back to our main slide here. So the first step is Medicare Part A and Medicare Part B. Then you be choosing between option number 1 and option number 2. So there's 2 big differences between option number 1 and option number 2. Option number 2, the Medicare Advantage plan, these are network-driven plans. So you can only go to doctors and hospitals that are in your plan's network. Whereas option 1, the supplement plan does not have a network. You can go and see anybody that you want to. That being said, with the Advantage plans, even though they're network-driven, the networks with these plans are huge, extremely vast networks. So like we'll use Anthem or United Healthcare, for our example. Both of those plans have all of the hospitals in the area, all in the network. So Mercy, BJC, SSM, Barnes, St. Luke's, SLU, so on. So huge networks of doctors, much larger than you've ever been used to in the past. That's big difference number 1 between the 2 plans here. Big difference number 2 is Medicare Advantage plans, option 2. These are managed care plans. So just like your employer plans from the past, your ACA plans you have now, those are all managed care plans. So it's no different here. What that means is, let's say you go to an orthopedic surgeon, or no, let's say you go to a doctor for a CAT scan. That doctor has to send off a pre-approval prior authorization request to your insurance company. That insurance company then approves or technically could deny that request for service. Things are not usually denied, but they could be. Again, same practice with your current plans you have now. Option 1, the supplement plan, they do not have that requirement for prior authorizations. So if you have option number 1, the doctor orders a CAT scan, he schedules it, you go and get it, that's it, no questions asked. So you have much more freedom, you have much more flexibility with option number 1, but it's going to come at a much higher cost in monthly premium. All right. Any questions so far?
So basically, the people who are eligible to get the Medicare Advantage or they have to have worked 10 years or 40 quarters. Or,
Kind of. So in order to be eligible for either one of option number 1 or option number 2, you have to first have Medicare Part A and Part B, which is done through the Social Security office.
yes,
So to get Part A, you personally have had to have worked 10 years or 40 quarters, or be married and have a spouse who has worked 10 years or 40 quarters.
Oh.
And then you'd still be eligible.
Oh.
If neither of those are the case, you can still get Part A, but you're going to pay per month to have it, whereas it's free to the other people.
so as I have been in touch with many elderlies, and they have Medicare, and they have a Medicare card for their health insurance.
Right.
But I've never seen why they have not gone to like taking advantage of the supplement or the Advantage Plus.
They probably do. They might not even know it. So if somebody has the option, so first off, I would never recommend to a client to only have Part A and Part B and nothing else, because again, Part A and Part B, you're paying 20% for everything with no cap. So you really need that secondary plan to put those caps in place. A lot of times people will think, oh, I have Medicare, and not even know that they have one of these different options here. That happens often. I don't see it a whole lot of times where somebody just has Part A and Part B. So that, I mean, they could. I don't know why they would. Yeah, if you talk to them and they say that they're going to the doctor and they're forking out a whole lot of money for services, then they may only have Part A and Part B. I'd be happy to talk with them, or I would definitely recommend it though. Yeah, definitely. And whether it's me as an agent or a different agent, I highly recommend going through an agent. Like Dr. Baines was saying earlier, health insurance agents are paid a commission when you're going with one of these insurance companies, but we're extremely knowledgeable in all the different plans. So like, just example, the Medicare Advantage plan, there's like 12 different insurance companies in this area who offer these Medicare Advantage plans. So what I would do, or an agent would do, is we would look at every one of your doctors, all of your medications, figure out which plan covers them the best, and then kind of compare side by side all of these different plans. And what is the best part that I like most about my job is that I, again, am paid a commission. The amount that I am paid is the exact same with every one of these insurance companies. So I'm not incentivized, no other agent is incentivized to push one plan over the other because we get paid more, because it's the exact same. Highly recommend going through an agent, whether it's me or somebody different. Great question.
Yeah, I have one more question.
Please, yeah.
Sorry. Is it a difference? My parents, actually, I'm talking about them.
Sure.
They have enrolled in an Advantage Plus program, but after a couple of years, we noticed that their services are getting less and less of the benefit that they used to get. So is this something that you have to always shop for?
Yes, I recommend it. So these Advantage plans are subject to change every year. So they could have a copay that goes from $25 up to $50. Their dental insurance could go from $2,000 down to $1,000, or vice versa. They could get better in benefit. But yes, I always recommend to all of my clients to review the plans every year. So the main time to change plans is October 15th through December 7th. That's the annual enrollment period. That's when you're seeing all the commercials on TV, all the advertisements on the radio, and so on, being bombarded. That's the time I always recommend reviewing plans, because they do change every year. And your situation also changes every year. So they might, be taking a new medication they weren't in the past, or seeing a new doctor. So it's important to review every year to make sure that their current plan is still the best option. I always recommend that.
Thank you.
Very welcome.
You said you were paid the same amount, same percentage of what commission, or the same dollar amount?
It's a flat dollar amount.
Okay, it's a flat dollar amount.
Yeah, well, I mean,
And give me the dates when the renewals come up, or you have to switch plans?
yeah, so maybe your first question is the exact same amount. So a person, again, commission. So like if someone goes with the Advantage plan, 8 different insurance companies who offer several different plans, it's a flat dollar amount that the agent is paid, exact same for everyone. The supplement plan is a little bit different. That one can be a percentage, but in the end, it ends up being almost the exact same between the two different options. One pays a little bit more up front, one pays a little bit more throughout the year. So it ends up being like a $25 difference. But yeah, this is the exact same in a sense. And then your other question about dates.
The dates for changing plans and renewals.
Yeah, so if you, the main time is October 15th through December 7th. That's called the annual enrollment period. During that time, you can make any changes to your Medicare plans. There's another time, January 1st through March 31st. This is called the Medicare Advantage open enrollment period. This time is not advertised, so they're not allowed to send out marketing materials and things, but it's still there. So this January through March time is just for somebody who already has a Medicare Advantage plan to look at changing to a different Advantage plan company. So going from Aetna to United Healthcare or whatever. So you can do that during these first 3 months of the year as well. Something else to note, when you are first turning 65 or first enrolling in Medicare Part B, you can enroll in option number 1, that supplement plan, no questions asked, no underwriting, no health questions. They have to accept you no matter your health status. There's never any underwriting, never any health questions with the Medicare Advantage plan, ever. So let's say you turn 65 in June, you enroll in the Medicare Advantage plan, have it for a couple of years, decide you don't like it, you want to switch to that supplement plan G. To switch from here to option 1, you do have to go through underwriting, answer health questions, and could potentially be denied coverage. If you were denied coverage, you would not be losing your Advantage plan. You just might not be able to get that plan G at a later date. All right. More questions on this topic? Please.
So when someone picks up option 1 or option 2, is that the donut hole thing?
I'm sorry?
Is that the donut hole?
The donut hole. No, it's not. So I don't know if I have a slide on the donut hole actually. Hang on 1 second. I don't think that I do actually. Okay. So our question is in regards to the donut hole or coverage gap. This is in reference to the Part D for medication side of things. So every Part D plan, no matter if you're getting with option number 1 or option number 2, all Part D plans have the same internal mechanism. These numbers on here are from last year, so I'm going to give you the correct numbers out loud, so just don't pay attention to those. So every plan, every Part D plan has 4 different stages, every plan. The first stage is the annual deductible stage. So some plans have a deductible, some plans don't. The main stage is this guy right here. So this is the initial coverage stage. In the initial coverage stage, you are paying small co-pays for your medications as you pick them up from the pharmacy. I'm going to use an example of a medication called Eliquis. Eliquis is a blood thinner and it's very expensive. So the retail value of Eliquis without insurance is about $500. With no insurance, you pay $500 for Eliquis. Eliquis is a tier 3 drug. So in this initial coverage stage, you're going to pay a small $47 copay for this $500 Eliquis. Every time you pick up that medication from the pharmacy, even though you're only paying $47, the $500 retail amount is going toward a threshold number, which is $5,030 this year. So the $500 goes towards this $5,000 number. If that $5,000 number gets hit, you go into the donut hole, aka coverage gap. In this donut hole, instead of paying that small $47 copay, you're now paying 25% of the cost of that medication. So you're paying 25% of $500, which is $125 for 1 month supply of Eliquis. That's based on all of your medications. So if you're taking Eliquis plus 5 more drugs, the retail value of all of those drugs each month is going towards that $5,000 number. And then in the donut hole, you're paying 25% of all of the medications as well.
So once you hit that threshold, then basically across the board, you're paying the 25%.
Correct. Except for some very low cost drugs like a blood pressure drug or cholesterol medication, you're usually paying $0 for that drug all through the year. It's just the higher cost drugs that you end up paying 25% of.
Okay, so I just kind of want to quickly do a little cap for myself, so I think I understand.
Yeah, please.
So if somebody has had their 40 payments or whatever towards Medicare and Social Security and whatnot.
Yes.
You automatically get Part A and Part B at no cost.
No. So so you have to have worked 40 credits. You have to be over age 65 or on drawing social security benefits due to disability. That's the first requirement. Then if you've worked those 40 credits, you get Part A for free. You don't pay for Part A, but you do pay a premium to be enrolled in Medicare Part B.
Okay,
That Part B premium, the standard amount is $174.70 per month.
okay. Okay. So I'm trying to figure out what the minimum cost to somebody is who has had those 40 payments or
Quarters.
whatnot, right?
Yes,
Or
Is it the one, is it the 174?
correct.
And then you can go to the Advantage, the Medicare Advantage, which is zero cost.
Yes,
So basically, for the 174, you can get Part A, Part B.
and the
D.
advantage, yes,
Okay, and does a spouse who doesn't have the 40 payments or is not eligible, hasn't put in the whatever, the minimum amount for social security or whatnot.
Right.
If I have met that criteria, he gets the coverage.
correct.
Okay,
Yeah, so I'm working with somebody right now. He just moved here. I think he just moved here from Greece. So he's been here for like 6 or 7 years, and he's never worked. He was married, so his spouse has worked, 30 years or whatever. So even though he's only been here for 7 years, he's never worked. He still gets Part A for free because his spouse met those requirements.
right,
For Part A, he'll still pay for Part B as everybody does.
May
okay.
I ask one more question?
Please, yeah.
If the spouse has passed away, does it still, would it be acceptable? For the person who's.
Yeah.
The other spouse that
Yes,
is alive.
yes, I don't see, as long as you had been married for that time, then yeah, that won't be an
Does
issue.
it have to be a 10 years marriage or no? It doesn't have to be.
No, I don't think there's a limit on marriage. I don't think there's a limit on
But there
marriage.
was some kind of a limitation for the marriage to receive some kind of a.
There could be a limit on receiving like a spousal benefit for the actual social security benefit.
Okay,
I don't think there's any
not for
duration.
the Medicare.
I don't think so, as far as I know. Because like I said, this person, they've been married for like 7 years since he got here, and there was no 10-year
I see.
deal. The 10 years is having worked 10 years.
Yes.
Yes,
To fill the 40 quarters.
exactly. Good question.
So is the spouse then who has not worked here for, the spouse who's just been married for 7 years and has not worked here, is he then having to pay the 174 as well?
Yes, everybody pays that 174. And that 174 is based on income. So if income is above, if you file your taxes jointly and it's above, I think 203,000 this year, then you'll pay more for your Part B.
Right.
And that's that chart that I showed you.
Okay.
Good questions. Anything else? All right, let's talk about timeline and enrollment periods here. I think we're getting close on time. So the initial enrollment period in Medicare is a 7-month-long period. It begins 3 months before your birth month, extends through your birth month, and 3 months after your birth month. So let's say you turn 65 in June. You'll have the months of March, April, and May to apply for Medicare, in which case your Medicare will start on June 1st, as long as your birthday does not fall on the 1st of the month. If it does, then it's actually effective the month before you turn 65. So you turn 65 on June 20th, your Medicare can start as early as June 1st, as long as you enroll in those 3 months leading up to June. All right. If you apply for Medicare in June, Medicare starts July 1st. If you apply in July, August 1st, and so on. That's your initial enrollment period. That's when you apply for Part A and Part B. That's also the same time that you would apply for your Medicare Advantage plan or your Medicare Supplement plan and Part D plan, all done in those 3 months leading up to your birth month, right? Special enrollment periods. If you are over age 65 and you are on an employer-sponsored plan, and that employer is over 20 employees, you do not have to go on to Medicare at that time. You can continue to work, you can continue to stay on that employer plan as long as it's based on active employment, not a retiree or COBRA plan, but active employment. You do not have to get Medicare at that time. You can then delay getting Medicare until you are ready to do it, or until you retire. So you have an 8-month window to then sign up for Medicare once you lose insurance based on your active employment. I have a lot of clients who will be turning 65. They don't plan on retiring for a couple of years, so they have good health insurance through their employer. So at that point, we would sit down and compare the costs and benefits with the Medicare plan to the costs and benefits with their employer plan, and just figure out what makes the most sense for them going forward. Sometimes it'll be the best case for them to stay with the employer plan. Usually it's not, but if it is, they just stick with it until they retire, call me back in a couple of years, and they get Medicare without issue. All right, as long as it's based on active employment and the employer is over 20 employees. We already talked about this one. There are late enrollment penalties. If you do not sign up for Medicare Part B as in boy or Part D as in dog, you are penalized for all the months you go without credible coverage and you could have had it. Going back to the whole working deal, if you're working on an employer plan over 20 employees and then you decide to come off Medicare at say 67, at that point you are not penalized because you had credible coverage through the employer. But if you turn 65, you don't have any insurance for a couple of years, and then go on to Medicare, you're going to incur a monthly penalty for Part B and Part D as a dog. So you just don't want to ever have a lapse in coverage. If there's no lapse in coverage, there'll be no issues, right? We talked about this annual enrollment period, October 15th through December 7th is when you can make changes to your Medicare plans. We talked about January 1st through March 31st is the time you can change from one Advantage plan to another. There's all types of special enrollment periods to enroll Medicare throughout the year, just depending on the circumstance. That's about it. Do we have any questions? I kind of flew through that presentation, so I apologize for moving so quickly. Do we have any other questions? We asked some good ones. Anything else? No?
I have one
Yes,
question.
please.
So based on the drug part of the coverage, each company has their own rules and regulations. Where, like, for example, Aetna goes by their own, Anthem goes by their own thing, and so does the United Healthcare. So if, for example, I'm changing my parents' coverage to another company, we have been having problem of getting one of my mom's medication, and I just want to know how can we deal with that so we won't have this problem.
Having problems like because it's out of stock, or having problems because it's expensive?
So the thing is, it is a brand name, and that's the only way she can take that particular drug. And it's just like, I don't know if they're going to discontinue it.
Yeah. So every plan is different. So Aetna, United Healthcare, Anthem, so on. Medicare tells all of these insurance companies that insurance company has to cover at least one drug in every therapeutic class. So let's say it's a blood pressure medication, they're going to cover X drug, but not Y drug. So each company chooses what medications they're going to cover and which ones they're not going to cover. Each plan is different. So one company might cover this brand name drug, or a different company might not cover it at all.
Right.
So that's what I would kind of come in and do on Medicare.gov, type in the drug. Do you want to tell me what the drug is, or?
Yes, Crestor.
Crestor. So I think the generic for Crestor is atorvastatin. Does that sound right?
Something like that.
Okay, so Crestor is the brand name. So on Medicare.gov, we type in Crestor. It would say Aetna covers Crestor, United Healthcare, Anthem do not cover Crestor, and so on. So it'll tell us which plan covers it, and which plan covers it the best.
Thank you.
Yeah, happy to help.
So Medicare.com?
Medicare.gov.
Gov, okay.
Yes. Yes.
I'm on Medicare and I get a lot of calls or people wanting to get me the new plan D, I guess, or whatever. And I got something in the mail. It talks about all the benefits you could be getting, like for groceries or this.
$3,000 a year for groceries,
Or whatever. Well,
so on.
$1,600.
$1,600.
I'm afraid to talk to these people, especially the ones that call.
Yes.
And when we call the number back, the number's not in certain. I've never heard anything like this. So that makes me leery.
Be leery. Be very leery if someone calls you, or to call a 1-800 number like on TV or something.
The other thing is my insurance carrier, Aetna, had a cyber hit, and all of our information was out there. And so that made me even more afraid to talk to anybody. But then I did want to know, am I missing benefits?
Good questions. So United Healthcare, just had a huge cyber attack and it affected several other companies, Aetna being one of them. Don't let that be an issue when you're getting these phone calls. People that are calling you are agents, similar to myself. We're not supposed to be able to allow to just cold call you, so they're already doing something fraudulent. When they call you, never use the word yes on the phone and never give anybody your Medicare ID number. So what'll happen is they'll call you or you'll call them. They'll try to change your plan to a different plan as fast as they can, even without you sometimes even realizing that they're changing your plan. So never say yes on the phone, never give them your Medicare ID number. The grocery thing. Most of the advertisements that you see on TV saying get $3,000 for groceries, get money for utilities and mortgage and this and that. They are real plans. Those are a type of Medicare Advantage plan, but those plans are only for people who have Medicare and Medicaid. So if you have
Which I
Medicaid,
do not.
then you will not. But it's deceiving because they say, oh yeah, you can get this benefit. Just call me and I can tell you if you can get it or not. Well, when they find out you can't get it, they're just trying to switch you to a different plan as quick as they can.
Okay.
Please.
So I'm getting some of the same nuisance calls and text messages, but they're actually saying that they're coming through the NAR, the National Association of Realtors. So that makes it seem legitimate. So one of them said, text yes for more information, blah, blah, blah. So I did text yes for more information. And then I said, can I have your full name? And are you independent or are you with a company? And I never heard back from the person. So that told me what I needed to hear. But I had a pretty specific question if you have a minute.
Yeah, well, I'm going to talk about that other thing. Dan, do you know anything about the text message? Because I think you mentioned it too.
Yeah, we receive a multitude of complaints from our members that are getting those spam texts and phone calls. I would just say this, that they are not getting that information from St. Louis Realtors. Our privacy policy does not allow us to give out your information like that. NAR has stated that their privacy policy is essentially the same.
Okay, good to know.
So where they're getting that information from, I'm not sure, but we are not giving it to them.
And there's lists out there of not necessarily people who are realtors, but people who are just getting ready to turn age 65. Those lists are out there. So that's why you're getting called right now, is because you're on a list somewhere.
Right.
Yeah, just be very leery of anybody calling you. No one's going to call you from Medicare. No one's going to call you from Social Security. If they say that, they're lying.
And if you think about it, being in the line of work that you're in, I mean, realtors are putting their phone numbers out there in the public, understandably. And so, who knows where it's coming from.
What was your...
So I had a pretty specific question, so please bear with me.
Yeah, sure.
So I was married for 20 years, now divorced. Now I did work my 40,
40 credits.
40, what's the right term?
40 credits.
Credits.
Yeah.
So I do have my 40 credits. However, I qualify under my ex-husband as well for Social Security for quite a bit more, because obviously
Sure.
he worked for way longer and his salary was much different to mine. So if I get benefits under him, now divorced, but I have a new husband, can my new husband, who's never worked in the USA but did work somewhere else for 30 years, because I'm getting my benefits under my ex-husband, does that matter at all?
No, I don't think it will, because when you get Medicare or Social Security cash benefits, they don't go hand in hand. So you can go and get Medicare when you turn 65 under your Social Security number, and then 3 years later draw your ex-husband's benefit. So that's not an issue. So yes, your current husband could get Medicare under you. Yeah, that's not a problem.
Okay.
No problem at all. And you can still draw his benefits too. That's also not an issue. You're not go hand in hand. And your question earlier, I don't think I answered fully. So I'm going to ask, like, when someone turns 65, when you are turning 65, becoming eligible for Medicare, you are not automatically enrolled into Medicare Part A or Part B. You are only automatically enrolled if you are drawing Social Security cash benefits when you turn 65. If you're not drawing benefits, you have to initiate the enrollment into Medicare, which is done through the Social Security office, usually easiest done online through ssa.gov. You go in, fill out an application through your account, and it gets approved in a week or two. So you have to initiate that first enrollment.
Thank you.
Absolutely.
Good presentation.
Thank you. I appreciate it. Thank you. Anything else? No, I'll stick around for a minute. If you guys do have questions, happy to answer them.
Thank you.
Yes, thank you.
Let's
And-
give Colton a round of applause. Thank you, Colton.
Yes.
Great
Thank you.
information.
Happy to help.
Very much.
And my number's in the packet too, so feel free to
Yeah.
give me a call anytime.
This is from the gentleman.
Okay, perfect. Most definitely.